Dr. Larson, giving you the COVID-19 update. We continue to have a few cases trickle in related to our Twin City Foods outbreak, but essentially everyone's doing well, no one's been hospitalized, and people are getting the services they need. So we expect this weekend to have more folks kind of trickle in. We will be putting our review and our plan for this back to Secretary Wiesman early Tuesday morning, and expect to get an answer on our variance request on Tuesday. So I'm going to answer some questions today, but I'm asking you all to not go camping this weekend. It's actually illegal to go camping, to stay at home, stay healthy, and we'll go to the questions.
I cut you off on my recorder last time. So I know someone in the community had symptoms of COVID but did not quarantine. What can I do?
Yeah, so really all you can do is support that person, try to stay away from that person if you can, wear a mask, ask the person to wear a mask if it's one of your neighbors. We can't really force people into quarantine. All we can do is support them. So you don't really know what their story is. There's a lot of rumors of this person had COVID or this person was supposed to be quarantined, and the only person that really is going to know what's true is that person themselves. So my answer to that is just to be kind.
Can you provide an update on antibody testing? Is there a COVID-19 specific test available now?
Yeah, I like that question. It's a great question, and the answer is yes. There's a specific COVID-19 antibody testing done by our hospital, run through LabCorp, but there's other good ones out there too. The problem with that particular test, and we don't really know exactly when we're going to have all the data, but it's not good for diagnosing you with COVID-19 if you're sick. So if someone is sick, we would still do the nasal swab to look for acute illness, and then the serology, the blood test, to look for if you've had it before. The antibody test is not perfect, but it's pretty good. And what we don't know is that if you have antibodies to COVID-19, whether you have any long-lasting immunity or what kind of immunity you have. So more to come on that. The data is coming in, but we do have that testing, and I've personally ordered that for a couple specific people for specific reasons. But unfortunately, it doesn't really negate you having to wear a mask or social distancing, at least not yet.
What is difficult for people is the inconsistency between likelihood of getting an infection and the ability to open. For example, why can two groups of people who've been quarantined for 14 days not be in contact with each other? Seems they are not at risk. Or camping with your family in the woods. Why the inconsistency?
Yeah, actually, you're talking about consistency, not inconsistency. So I'll answer the second part of that question first. So, and we've answered that before for some people, but if you have two groups of people that have been quarantining, that's two little bubbles. You put those bubbles together, and the more bubbles that you put together, the more likelihood that somebody from that bubble actually reaches out and touches somebody else. So in my house, I have 4 people in my house. Those are the people that I'm around. I don't get together with another group of 4 people from another house because they're not my immediate family. So it just lowers the risk. So we're being consistent in regards to that. I think what you're saying about inconsistent is why, for example, big box stores can open and a small shoe store can't. I do believe that that's inconsistent. I agree with that. But the big box stores were open to provide food, and it's unfortunate that we can't kind of move along with that and move into phase 2. So hopefully next week we'll be into phase 2 and those smaller stores can open back up again.
The incubation period is 14 days for COVID-19 with a mean of 11 and a half days. Why are Twin City food workers allowed to go back to work prior to the 14-day quarantine? Even if they test negative, they're still in an incubation period. This is affecting our return to work for the rest of us. You've stated yourself if a family member has been in contact, then 14-day quarantine.
Yeah, so that's the difference between isolation and quarantine. So somebody who's positive has a shorter time that they have to avoid being around other people because they've already had the disease. So everyone that's released to go back to work at Twin Cities or another business, if they're working for somewhere else, is cleared by me personally through public health to go back to work, the likelihood of that person being infectious to somebody else is very, very low. The person who's not had COVID-19 and is just exposed to that person, that's the person who's at risk of giving it to others, and that person has to stay home for 14 days after the person that's positive stops having symptoms. So it could be longer than 14 days.
That's the end of the questions for today.
So I'm just going to throw something out for the weekend. Make sure you're safe. Make sure you're washing your hands. Wear a mask when you're not able to maintain that 6-foot social distance, and remember to be kind. Take care. Bye.